Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good evening, everyone. Start with a different way of thinking about sleeplessness. Do not picture it only as not enough melatonin or too much stress. Picture it as a nervous system that has forgotten how to downshift. The lights are off, the room is quiet, the body is tired, yet the brain keeps scanning, calculating, remembering, predicting. Why does that happen? Why can a person feel exhausted and still remain awake? And how could a simple mineral, zinc, have anything to do with something as complex as sleep? Here is the key idea. Zinc is not a knockout pill. Do not treat it like a sedative. Treat it as a biological tuning factor. It participates in hundreds of enzymatic reactions, helps regulate cell signaling, supports immune and nervous system function, and appears to influence neurotransmission involved in sleep stability. The National Institutes of Health describes zinc as essential for cellular metabolism, enzyme activity, immune function, protein synthesis, DNA synthesis, wound healing, and cell signaling. That already tells us we are not dealing with a minor nutrient. We are dealing with a small element that speaks many biological languages at once. Now ask, why might that matter at night? Because sleep is not simply the absence of wakefulness. Sleep is an active neurological state. The brain must reduce threat monitoring, coordinate circadian signals, balance excitation and inhibition, stabilize temperature rhythms, and allow restorative processes to begin. If the body lacks the micronutrient support needed for those processes, sleep may become lighter, later, more fragmented, or less refreshing. So listen carefully. Do not hear zinc cures sleeplessness. Here's something more precise. Zinc may help certain people sleep better when their physiology is missing a piece of the sleep regulation puzzle. That is the difference between a claim and a clinically responsible explanation. First, understand the pathway. Why would zinc help the brain settle? One important clue comes from sleep biology research describing zinc as a sleep modulator. In a scientific review focused specifically on dietary zinc and sleep, researchers discussed zinc's role in neuronal activity and signaling and reviewed human and animal evidence linking zinc intake with sleep regulation. The language is important. Modulator, not anesthetic, not tranquilizer. Modulator means it may adjust the system rather than force it. Think of the nighttime brain as an orchestra. Excitatory signals are the brass section, alert, loud, forward. Inhibitory signals are the strings and woodwinds, smoothing, calming, organizing. Insomnia often feels like the brass section refusing to lower its volume. Zinc interacts with neurotransmitter systems involved in excitation and inhibition, including glutamatergic and glycinergic signaling. How does that matter? If excitatory tone remains too high, the brain may keep producing wakefulness. If inhibitory tone is properly supported, sleep has a better chance to arrive and stay. Now make this practical. When someone says, "I lie down, but my mind will not turn off," ask, is this purely psychological, or is the nervous system chemically undersupported? Do not jump to one answer. Investigate both. Stress, caffeine, light exposure, pain, sleep apnea, medications, alcohol, depression, anxiety, and irregular schedules can all disrupt sleep. But micronutrient status can also influence how resilient the sleep system is. Second, connect zinc to circadian rhythm and melatonin biology. How does the body know it is night? Through light, the retina, the suprachiasmatic nucleus, body temperature, cortisol timing, and melatonin secretion. Melatonin is not simply a supplement, it is a darkness signal. Zinc does not replace darkness. Do not expect a capsule to undo bright screens, late caffeine, and chaotic bedtimes. But zinc may support some of the biochemical environment in which healthy rhythm signals operate. A clinical trial in older adults with primary insomnia tested a combination of melatonin, magnesium, and zinc taken 1 hour before bedtime for 8 weeks. The participants receiving the combination improved substantially on the Pittsburgh Sleep Quality Index, and they also showed improvements in sleep-related measures such as ease of getting to sleep, sleep quality, morning alertness, and total sleep time. Because this trial used a combination, do not give zinc all the credit. Be exact. Zinc was part of a targeted nighttime formula, and the results suggest that sleep may respond when rhythm support, mineral support, and timing are aligned. Why is that meaningful? Because many people chase sleep with force. They want something that shuts the brain off. But the body often responds better to sequence. Morning light, consistent waking time, stable meals, evening dimness, then properly timed nutritional support. Tell the body the same story every day, and it becomes easier for the brain to believe night has arrived. Third, look at people under high sleep pressure. Consider shift workers, especially nurses. Their sleep is not merely challenged. It is repeatedly attacked by light at the wrong time, stress at the wrong time, meals at the wrong time, and alertness demands at the wrong time. In a double-blind, randomized controlled trial involving ICU nurses with poor sleep, participants received zinc sulfate every 72 hours for 1 month. Compared with placebo, the zinc group had significantly improved total Pittsburgh Sleep Quality Index scores, subjective sleep quality, and sleep latency, while serum zinc levels also increased. Ask yourself, why would this be especially interesting in night shift workers? Because their sleep system is under mechanical stress from schedule disruption. If zinc status is low or borderline, the body may have less capacity to stabilize sleep under pressure. In that setting, zinc is not magic. It may be reinforcement. It may be one beam in a bridge that is carrying too much weight. Fourth, examine the broader evidence. A 2024 systematic review of randomized controlled trials evaluated zinc supplementation and sleep quality in humans. It included 8 studies with interventions ranging from 4 to 48 weeks and zinc doses ranging from 10 to 73.3 milligrams per day. The authors found that much of the evidence pointed toward improved sleep quality in adults, but they also emphasized that findings were not fully consistent and that more trials are needed, especially in people with confirmed zinc deficiency. This is where we must be mature. Do not exaggerate. Do not say, everyone with sleeplessness should take zinc. Say this: zinc has a plausible biological role, some clinical evidence, and a better rationale in people with low intake, low serum zinc, high stress physiology, older age, restrictive diets, malabsorption, heavy alcohol use, or demanding night schedules. Now ask, how do you use this information wisely? Begin with food. Do that first. Zinc-rich foods include oysters, beef, poultry, seafood, dairy, beans, nuts, seeds, and whole grains. But pay attention, zinc from plant foods can be less available because phytates in beans, grains, and seeds can reduce absorption. That does not mean plant foods are bad. It means preparation matters. Soak beans, ferment grains, use sourdough. Pair plant proteins thoughtfully. Build the meal, do not merely swallow the pill. The NIH notes that vegetarians and vegans often have lower zinc intakes and lower serum zinc levels than people who include animal foods, partly because plant-based diets contain phytates that reduce zinc bioavailability. Then consider supplementation only if it makes sense. Use discipline. For many adults, the recommended dietary allowance is 11 milligrams per day for men and 8 milligrams per day for women. Pregnancy and lactation require different amounts. The adult tolerable upper intake level is 40 milligrams per day from all sources unless a clinician directs otherwise. Do not casually take 50 milligrams every night for months. More is not smarter. More can become a different kind of stress. How should someone approach it if they want to discuss zinc with a clinician? Try a conservative, structured experiment. Choose a modest dose, often around the daily value range, rather than a megadose. Take it with dinner or about 1 to 2 hours before bed if it does not upset the stomach. Do not take it at the same time as high-dose iron because substantial iron intake can reduce zinc absorption. Track sleep, latency, awakenings, sleep depth, dreams, morning alertness, and next day mood for 2 to 4 weeks. Change one variable at a time. If you change caffeine, bedtime, magnesium, melatonin, and zinc all at once, how will you know what helped? Also, protect copper balance. High zinc intake can interfere with copper absorption, and excessive zinc supplementation can lead to copper deficiency. The NIH Office of Dietary Supplements specifically warns about this interaction, so if someone is using zinc beyond ordinary dietary levels for more than a short period, tell them. Talk with a healthcare professional, review total intake from multivitamins and lozenges, and consider whether copper status needs attention. Now integrate zinc with proper insomnia care. Do not allow a supplement to distract from diagnosis. If someone snores loudly, wakes gasping, has morning headaches, or feels sleepy while driving, screen for sleep apnea. If legs crawl or jerk at night, evaluate restless legs syndrome and iron status. If early morning awakening comes with low mood, assess depression. If sleep is broken by reflux, pain, hot flashes, alcohol, or medications, address those. Why? Because zinc cannot correct an untreated airway, a stimulant medication taken late, or a circadian schedule that changes every night. And remember the standard of care. The American College of Physicians recommends cognitive behavioral therapy for insomnia as the initial treatment for adults with chronic insomnia, and the American Academy of Sleep Medicine strongly recommends multi-component CBTI for chronic insomnia disorder. That matters because CBTI targets the learned hyperarousal and behavioral conditioning that keep insomnia alive. Use zinc as support when appropriate. Do not use it as a substitute for a proven insomnia framework. So here is the strategy. Command the day before you command the night. Wake at the same time. Get outdoor light early. Move your body. Stop caffeine early enough for your metabolism. Eat enough protein and micronutrients. Dim lights in the evening. Keep the bed for sleep and intimacy, not scrolling and worrying. If you choose zinc, choose it thoughtfully. Track it. Respect dosage. Pair it with behavior. Ask, what is this intervention supposed to change? Sleep onset, sleep depth, awakenings, or morning recovery? Define the target before you begin. Why does this approach work better? Because insomnia is often maintained by loops. Worry creates arousal. Arousal creates wakefulness. Wakefulness creates fear of the next night. The bed becomes a threat cue. Zinc may help the biological side of settling, but your routine must stop feeding the loop. Do both. Calm the chemistry and retrain the pattern. So let us close with a clear message. Zinc may be beneficial for sleep because it sits at the intersection of neurotransmission, circadian biology, immune tone, and cellular repair. It may help some people fall asleep more easily, experience better perceived sleep quality, and wake with greater clarity, especially when zinc intake or zinc status is not ideal. But use it with precision. Do not megadose. Do not ignore copper. Do not overlook sleep apnea, anxiety, depression, pain, medications, or poor sleep timing. Build the foundation, then add zinc only where it belongs. Ask yourself tonight, what is my body missing? Darkness, rhythm, safety, nutrients, or treatment? Then act in that order. Take care of your sleep like you would take care of someone you love, patiently, intelligently, and consistently. Thank you, my friends. Stay well, rest well, and I'll see you with our whole community in the next topic.